a start. It's not all going to be like that, I'm afraid. My name is Jim Huddy, Cornwall's clinical lead for chronic pain, and here's our latest production for you about alternatives to medication for chronic pain. Hope you enjoy it. Jim, if I don't prescribe, what do I do? Well, you watch this, try and stick it out. I've made it as quick as I can. Here we go. Ooh, this looks a bit tense. Let me give you an idea of how to use multiple consultations to get where we want to be. Consultation 1 is sit back and listen. Take a history, find the story from start to end, what treatments have been used regarding the chronic pain, and do the doctory bits. Is the diagnosis sure? Do any further tests need to be done? Consider and exclude organic disease, and you can run that alongside chronic pain management. So in consultation 2, we're going to focus more on the chronic pain cycle and the self-care cycle. In your accompanying documents, you've got this one-sheeter which explains very well how things go from bad to worse and how they can get better. The pain cycle, the patient actually can probably tell you. It's the amalgamation of chronic pain and all of the things that go along with it and how they all add together to produce a very challenging situation and a very unhappy life sometimes. Then what we go on to do is use the second half of the page to explain what self-management is. Self-management is the opposite to the downward spiral that they've been through. And by learning the skills that are shown on the self-care cycle and supporting them through that over the next few weeks, months, years, possibly decades, then life can get good again. They might not have the life they used to have, but they should be able to carve out a life that they're comfortable with. Right, in consultation 2, you have given the patient some hope, hopefully that downward spiral can be reversed into an upward spiral, and now it's time to find out the impact of the pain on them with the health needs assessment questionnaire. So we give them this form at the end of consultation number 2 to take home and do as a bit of homework. There are 13 questions on it which inquire about which part of their lives is most impacted by chronic pain, so that you can then form a patient-centred approach. Okay, this is looking better, isn't it? The patient's filled out the form for you, so now you can home in on what's important for them. Let's go through the answers. Now, don't be worried that you've got to remember all of this. There is the answers on the website in an interactive Word document, which has got all the meat on the bones. This is just all to give you a flavour. I'd like to say at this point that we're going to be talking about social prescribing and link workers. There's a lot going on, which is a separate discussion, but a really valuable resource for us in the world of pain. Number 1, physical fitness. This is a very common one. We've got some online resources, Health Talk and NHS Studios. Cornwall resources, we've got Get Active Cornwall and Walk Kerno. I'll show you a bit about these in a sec. Hang on, stop everything. I've just found something really cool. Have a look at this. Yes, healthtalk.org, which is patients basically describing their experience of their conditions and their treatments, sometimes young patients, hundreds of different categories. 2-hour specialised subject, long-term conditions, chronic pain. So for each of these pages down here, you'll find 5 or 6 or 7 patients, just a minute or two, describing their experience of, for example, the emotional impact of pain, sleep and pain, medications and pain, coping with flare-ups. It's a great resource and I'll talk about it quite a bit. The NHS Studio exercise video is pretty good actually. Pretty good. Lots of videos about aerobic stuff from beginner, intermediate stuff, bum toning. Watch that later. Care and support. So yeah, not a bad sort of national resource there. Here is the Get Active Cornwall homepage, where you can search for where you are and what you want to do. Martial arts in Truro, let's say, and yeah, up it comes, shows you what day of the week, contact details and all of that stuff. So that's a good directory of services for activity. And I was going to just mention that park run is quite fun. A 5k run in various places, usually on a Saturday, I think. Yeah, all sorts of things to look at here. Walk Kerno, this is a Nordic walking group. Nordic walking being walking but using poles, which adds to upper body activity. Beginner sessions, and then the walks themselves, which are of different levels of strenuousness. And you can book them on the calendar. And Tehiddy, Myla, Mornan, Gwithian, they're scattered around the county. Might be something there for you. Or locally, your link worker might be able to put you in touch with yoga, swim groups, aqua aerobics, walking, dancing, or Tai Chi. It won't surprise you to hear that people with chronic pain very often get socially isolated. So we've got some things to help, I hope. Health Talk is patients talking about their experience. Inclusion Cornwall is a group that can put people in touch with what's around them that can help. And Pentreath you probably know about classically for mental health issues and employment, but also a really good resource for helping isolation. Number 3, knowing how to self-manage chronic pain. Well, we are attempting to produce a do-it-yourself pain management program. It's kind of the holy grail of pain research at the moment, because if we can teach patients to do it themselves, then with our support, job done. But it is quite a challenge. So what does self-management mean? Well, we've touched on it with the self-care cycle, and in a nutshell it means a deeper understanding of why pain arises, and that there's no special pill or person or operation which is going to take it all away, and accepting how you are and carving out a life that is compatible with your symptoms rather than fighting against it. We need to be physically fitter, we need to be emotionally fitter, we learn how to pace ourselves, deal with setbacks, and set appropriate goals. So what have we got in our armoury to teach these skills? We've got the Pain Toolkit, My Live Well with Pain, Health Talk, and Sheffield Persistent Pain. Can I take you through the My Live Well with Pain resource? This is predominantly for patients. There's a sister website which I'll show you in a sec. This is for patients with lots of great stuff, and it's mentioned in the handout, explaining pain, sleeping with pain, opioids and various other medications, some videos about patient stories, and psychologists talking about acceptance and commitment, podcasts, books. Yeah, brilliant stuff. This is the sister website called Live Well with Pain. This is for clinicians, and there's some brilliant resources here for supporting self-management, shifting the conversation and helping you in the consultation with some video examples and some various things about medications. And I must say the newsletters are really good at keeping you up to date with what's going on in the world of pain, should you be interested. And you've got to check out the brilliant Lorimer Mosley's Tame the Beast video. I'll show you a clip.
But the pain remains like a loyal companion. The people's hopes faded, and they became resigned to living with the pain. Only now the pain was a beast. Then along came a group of researchers, of which I am one. Back off, big fella. I'm Professor Lorimer Mosley, and I'm a pain scientist. Pain scientists are starting to think differently about pain and its causes, and we're making exciting discoveries, like how the way you think about your pain can change the way it feels. Over the next few minutes, I'll help you to understand your pain. Understanding is important because it can change how much things hurt and how much your body can do, and it can help you to tame the beast.
Medications for chronic pain. Right, well, you've heard enough of me talking about this ad nauseam, so I'm not going to. So what have we got for patients about medications? Health Talk, Brain Man stops his opioids, and My Live Well with Pain information. Understanding why persistent pain happens. I'll give it a go. It's not as simple as you think. It's tempting to think that your knee pain is because your knee's injured and it's telling your brain that your knee's injured, but when it comes to chronic pains, that's just not the case. There are pathways up the spinal cord and there's pathways down the spinal cord. There's lots of different contributors from our conscious and our subconscious and from our bodies that form pain, from our past, from our present, from our future. And if the body feels that there's danger, if the body believes that a particular part of the body needs protecting, then it will create pain. It's very real pain, it hurts, we all know what it's like. But remember, it is a formation inside our physiological networks. What have we got for patients? Well, there's Professor Laura Mosley explaining what pain is. That's great for clinicians as well, and the Understanding Pain in 5 Minutes video, which you might have seen. Pacing oneself and avoiding the boom or bust trap. Well covered in the pain toolkit. Losing some weight and eating better. Well, 3 words. Cornwall Healthy Weight is a really, really good website to link you into local stuff for you and give you lots of ideas. Difficulty sleeping is a really common situation for people with chronic pain, so we've got a nice 10-page leaflet on Live Well with Pain website. And there's some interesting digital type technologies coming through here. Sleepio is web-based and has got some positive reports from the Lancet, and also Calm is an app that's for meditation and sleeping. In this section we're talking about how you feel, how your emotions are, and using techniques like mindfulness and meditation. At the end of the day, it's how we feel that's most important to our day-to-day experience, isn't it? So if you can change how you feel to fit how you are, then job done. So what have we got? We've got patients talking about their experience. We've got mindfulness stuff on the NHS website. We've got online mindfulness courses, some of which are paid for, some of which are free. And what's on in Cornwall, some group work. Outlook can do mindfulness courses for those who are suffering from anxiety or depression. And there's Mindfulness Cornwall, which is a paid for one-to-one or group work. Meditation could be described as a deeper state of mindfulness when things are quieter, and it's now being taught and used in Western society like it has been in Eastern society for thousands of years. Headspace is a really interesting development, and is actually becoming embedded into some medical research. Remember that all of these so-called new medical treatments are based on traditional teachings from 2,500 years ago, and we've got some ideas if you want to delve a bit deeper. Not surprising, is it, to get problems with relationships when you're in pain all the time. I think hearing it from the horse's mouth is a good way of maybe sort of accepting and being compassionate with yourself and with others. Have a look at Health Talk. Patients can hear other people talking of their experience of losing work in the context of pain at Health Talk. And regarding what's around to help them, we've got Pentreath, and the Job Centre's got disability employment advisors who are very skilled at knowing what's around to help people get back to work. Financial problems are well covered with the Citizens Advice Bureau. Right, okay, good. You've provided a personalised care plan for patients with chronic pain. That's quite a feat, so well done to you. It'd be good to see patients over and over, wouldn't it? Maybe every 2, 3, 4 weeks, something like that. See how they're doing. You can always pull out the pain cycle and the self-care cycle again. See how they're getting on. Bring out the health needs assessment form again. See if their priorities have changed. Put them back in the right direction. and generally speaking use motivational interviewing type techniques, which I can't even pretend to know anything about, so I won't even try. Good, you got it? Just to recap, Google search Cornwall formulary, get yourself through the LPC website, formulary front page, bottom left, chronic pain in Cornwall. There you have it. Right, what's going on this page? Well, firstly, at the top, "You are here" is a one-page flyer to print out, give it to patients, and they'll get to this page because they're going to need to access it to find out the answers. This is what you're listening to right now. Video, if I don't prescribe, what do I do? This is the paperwork that you need in consultation 2, the health needs assessment questionnaire and the pain cycle. And in the patient section, here's the health needs assessment form for them to fill out if they want to do it on their own and bring it to you. And last but by no means least, the answers for you, for the patients, for all of us. Any questions? Yep. How does this fit in with opioid deprescribing? Very good question. Well, it's up to you really, because there's lots of different styles. Personally, I think that if you're going to take something away, in brackets, medications, it's nice to give something in return. So if you can embed self-management, then I think you're on to a better wicket when it comes to deprescribing. Where next? There's some interesting ongoing research by Pain Concern about the use of guided history taking for chronic pain patients, and they are showing that it definitely facilitates the consultation, gets you much further on, it's all much more productive and satisfying. Just a few thank yous to my friends and colleagues at the Royal Cornwall Hospital, Keith Mitchell, Adrian Flynn, Paul Thornton, and to Dr. Francis Cole, who's been doing all this stuff for decades and is a font of knowledge. Thank you, Francis. Right, I've had enough. You've probably had enough. I'm going to stop there. Good luck.